Welcome, welcome, welcome. This is the Second Opinion Sports Medicine Podcast. I'm Dr. Dokel.
I'm Dr. Glass.
Dustin, good morning, my friend.
Good morning, brother. Yeah, it is. It's a little cold and rainy out this morning. I got my hoodie on. You got your hoodie on.
Yeah.
Got my Pro Sports Doc hoodie. Look at that, brother.
I love it.
Good.
It looks good.
Yeah, first merch.
I like it.
Yeah. Do I make it look good?
Dude, you're representing.
There
It
you
looks
go.
sharp.
Well, I appreciate you getting these done. That was pretty cool.
It looks like you did a few push-ups before we went live here.
Yeah, you have to, man. You have to get ready. Game ready, man.
Yeah. I see the sun creeping up behind you. Is it still dark where you're at, or is it a little bit light out?
Yeah, it's just peeking over the mountains right now, so we're getting the first sunlight.
I love this time of morning. I kind of wish we were like sharing a clinic, getting a little morning workout in before our patients, you know?
That'd be great. Yeah, maybe someday.
That's kind of the dream, man. I think there's a reality where, you know, there's another location that we open up in LA and, you know, maybe we can start working together and podcasting from workspace one day.
Yeah, that'd be great. Let's keep it out there. Keep that.
Yeah, you got to think about it before it becomes reality, you know?
Yep, exactly.
Speaking of thinking about it before it comes reality, we are at episode 50 today.
Woo, man, where's the streamers? Where's the balloons? Man.
I should have got a little you know,
yeah. Yeah, 50 is a big one. I remember when we first started this, it seemed so far away, but here we are.
It really did, and I think it was kind of, if I recall, we were saying, well, what is the bare minimum that we should do if we're going to commit to doing a podcast? And, you know, is it 5 episodes and we'll have a vibe on if we like it or not, or is it 10? And I think we kind of collectively came up to like, well, let's knock out 50. That's like a year's worth. We can kind of hone our craft a little bit and really give us a chance to grow and see if we like it. So before we jump into it, what's been your experience over the last year and some change?
Yeah, I was just thinking about that 50. I just feel like, and that was our first milestone. Like, let's get to 50 and let's see how we do, right? Like you said, Let's see if we even like it. See if we get the legs momentum. It seems so far away, and it seems like, and you were doing the research, and 50 is a lot for a lot of podcasters. I mean, that's a big number, and so we got a lot of content out there, and I feel like we've just begun to scratch the surface, and I'm excited about that. You know, it's 50 is a lot. We've gotten a lot. We've had a lot of trials and tribulations, fails, right? Part of the process, which is awesome because we've learned and we've become better. I mean, look at it now. We got ring lights, we got better mics, and it's just continuing. You know, we're collecting as we go, and pretty soon I won't have to hold this mic. You know,
yeah.
so that it will, and then that's the goal. But the experience has been awesome for me. I honestly look forward to these days. It's rejuvenating. It allows us to talk shop. It's doing exactly what we wanted to do. These are our conversations we've had over the years. Now we're just putting it and collecting it. So maybe somebody can get something out of it, right? But this is how we talk all the time on the phone. So I'm glad we've continued to do it. And I can't see us not doing it in the near future and the far future as well, so.
No, agreed, man. I'm enjoying it, and you said hopefully people are getting something out of it. I got to be honest with you, man. I re-listen to our episodes and I get something out of it. Mm-hmm. I'm like, oh man, that's right. Dustin talked about that, or, we discussed this and that was good feedback that you gave me. So I feel like I'm learning every time I listen to our episodes, even though, I'm half the equation here. So I appreciate the time. And honestly, I have fun doing it too. It's, sharing a highlight of my week, and it always seems pretty chaotic. I'm sure you're like, I think about you sometimes, man. I'm like, man, Dustin, okay, I'm married now too. He's been married a long time. He has kids. There's a lot of other obligations. You have patients, you have your office, you have your daughters, you have your wife, you're a friend, you're a son. And then beyond all of the minimum requirements, we're trying to get better at this thing called podcasting, and not just get better at it for the sake of growing our audience, although I guess that's a secondary sharing kind of goal. But sharing, to be quite honest, it's really about kind of learning more and to try to become a better physician, clinician for my patients. And I had a little imposter syndrome this last week, to be honest with you. I was thinking of you while I was working, and my dialogue was like terrible. You know?
Wait a minute. So you're saying that you were emulating me? My dialogue was terrible?
No, I was, well, I can see how that sounds like that. No, what I mean is I was like talking to myself as I was working on a client that was a very difficult case, and difficult in that we haven't achieved results in a couple of visits, and her pain level is super high. And I was really motivated and really trying to decrease her level of discomfort and pain and just make progress, and I got to the point where, you ever get to a point in an exam or a treatment and you're kind of like, you haven't hit the wall, but you're like, okay, I'm like missing something. I need to go a layer deeper. Like, let me ask more open-ended questions. Let me see if I can gain more information, some more data to make a better informed decision, and anyways, I was having a little trouble, and I mean, just like if I, missed a pass or something, I was like, bro, you suck right now. Like, you just, like, why can't you figure this out? Like, what are you missing, and I left that day and was like, dude, are you even a good doc? Like, you didn't figure this out for this one person. And I had 20 some odd people that day. And that was the one person that I just couldn't figure out, and it bothered me really, honestly, till later on that day. And my conclusion was that I don't suck, but like, I really felt that way in the moment. It felt like, a missed shot, or like, just a challenge I couldn't figure out, a puzzle I couldn't figure out. And so I was just thinking of you, thinking, okay, I know Dustin covers all the bases A to Z, asks all the questions, does all the orthopedic tests. And I don't know if that's always my default, and so I was just going through it and trying to figure it out and being hard on myself,
Yeah, I love that you shared that, because that's real life, man. So we share stories all the time of our successes, right? And that's normally what people do. Nobody talks about their failures or their mishaps or their missed shots, right? But those are the ones that grind on us. And that is the reality. Almost on a weekly basis, we have moments like that. That self-talk that you were just talking about, like in our head as we're treating and stuff, that's happening to me all the time. Like I'm questioning things, making sure I'm going over, and it's a constant in the back of the head, replay, and making sure we're doing our checks and balances. I love that you shared that, because I think, for our students listening and for our patients listening, that's the reality. We think, we might come across a certain way, but we are human too, right? And we have bad days too. And it's not always, things aren't always firing on all cylinders. At the end of the day, we're going to deliver the best, treatment and treatment plan, but the process sometimes is a little, there's a catch sometimes. So, that's just the reality. And like we talked about the other day, you don't remember typically the losses, right? But the reality is, as an athlete, you remember the missed shots. You remember, you reflect, and you go back in your head of what could have I done better? What could have I done to change the outcome? And that's how we grow, though, right? So if we didn't do that, and if we just failed and didn't learn anything from it and didn't give it a thought, then we're not growing. So
that's true.
Yeah. So I think we have to go through that to do a self-audit kind of at the end of the day, and make sure that we can do better. Right. So,
I was thinking back to when I was a younger chiro, my expectation wasn't that everybody leaves feeling better. I mean, it was, but that wasn't my outcome. I wasn't going 20 for 20, where 20 people came in and 20 people left feeling like they said, hey, I feel great right away, but it's grown to that where my expectation is everyone that comes in, before they leave, they're like, man, that felt great. I feel way better already. And if they're not saying that, now that feels like it wasn't a great treatment. And thinking back, the expectation honestly was, did I get an audible? Did I get the adjustment that I wanted? Was I able to manipulate the spine or, the joint the way that I wanted? And that was my measure of merit. And now it's more result oriented and, does the person feel better? It could be a great adjustment to me, but, if the person leaves feeling the same or worse, God forbid, then, that's my measure of merit. And so,
sharing,
I have my phone off because we're doing this podcast, but I saw it light up and I just kind of glanced over and the person that I was talking about texted me. I'm just going to read you this because this is a good example of why you shouldn't be too much in your head. She says, "Hi, this is Shannon, so-and-so. I was in yesterday and I feel incredibly better. Not all the way fixed. My eyes are messed up, man. Not all the way fixed, but I'm not having menacing pain and hardly any pain at my SI. I'm walking without that really bad limp." She said lump, but I think she means limp. She goes on to talk about some stuff about imaging, but
sharing.
There you go.
Maybe I didn't need to burn an hour of my evening stressing over that one.
Yeah. I'm glad you shared that second part because that's right. So looking back on it, man, and she's happy. She got the results she was hoping for. She's moving in the right direction. You're here, in the last, 24 hours, thinking about it,
Yeah. So. Well, I think with her, before we move on real quick, I can already tell it's going to be a long-term process because there's a lot of things going on. And so my last things to her that I said was
sharing.
We're looking for micro improvements, we're looking for a change. And if you feel a change in the positive, I want to know that even if it's minimal, I feel like, okay, we're headed in the right direction. And then the opposite's also true. If you feel worse or you feel the same, I need to know that as well. Not because it hurts my feelings. It's like, well, I need to make informed decisions from here on out, And so maybe that's what I was stressing on more is just like, hey, this is going to be a long journey to get her to where she wants to be ultimately. It's not just hey, I'm in pain, get me out of pain. There's more beyond that,
Yeah, I was just going to say that's a good point because about 3 to 5 years ago, I really started shifting my mindset based on my profession of how we've worked with athletes all these years. It has always been pain driven, right? Athletes would come in, I have this pain, fix me fast so I can play, right? So that's one setting. And then we have the clinical setting. The clinical setting is different than the on-site setting, right? But I would carry over with my patients the same mindset. So I would expect to reduce their pain and they'd be ready, right? But I started to shift my conversation with them and my education right off the bat to what you just said was it was no longer about their pain. It was about their function. So the first meeting we had was, listen, I know you're here because of the pain, but my primary goal for you is to restore your function because both of us know that if I can get things moving better, the pain will drop. The only reason the pain is there is because something's not moving well or working well, and it's trying to alert you about that. So if we stop focusing on the pain and start focusing on your function, we'll start seeing the results faster. That way now when they're coming in, we're hardly talking about their pain. We're talking about how are you moving today, which we both know that they're going to start noticing movement better than their pain right away. And so we shifted that education and that focus. And now the satisfaction rate is going up, even if their pain level is the same. They might still come in with a 6, 7, 8, but now they can move their head farther. And we're celebrating that win. We're like, man, we're that much closer. To your point, this is a long-term goal. This is not a quick fix. If we can just drop your pain, but it comes back next week, what good is that? So I really started shifting my whole practice to more function-based and restorative versus just pain. The pain's going to come. It's just like trying to, people want to lose weight to look good. But if you start focusing on losing weight for the health of it, the aesthetic part will come. The looks will come, but you change the thought process, right? So you start saying, hey, eat for your health, get well. And then they start looking better. Versus, hey, let's start losing weight. So, drop 2 dress sizes or drop whatever, you'll look better. Then they're frustrated when it's not going down.
Right.
And they don't realize how much healthier they are right now. Right. So
that's a great point. It's really a perspective shift where you're like, well, maybe, your pain level, like you said, is still a 4 out of 10. But last week you were walking with a limp and now you're walking without a limp. Your gait pattern is way better. yes, your pain level is still a 4 out of 10, but is that or is that not progress?
Yes.
And once you get the first, will the second thing not follow typically?
Right. Yeah.
And that is a perspective shift. I think that's something important I'm going to keep in mind this week, that is something that maybe we know all the time, but it's important to point out, I think, right?
Right. Yeah. And give them something tangible to start looking for and get them excited about moving. Right. So, because it's easy to focus on the pain. That's what drove them in there. But let's start focusing on what's really important is you moving. The other one of the analogies I give too, just to share, but as far as we're working and not seeing the results. My analogy is, the check engine light. We always use that, right? That's like your pain level, right? So you come in because you bring your car in because the check engine light comes on. Well, we determine that it's the oil is low. Okay, well, let's fill in the oil. So we put a quart of oil in and we think everything's good, but the light's still on and we're like, what the heck? So you bring it back and you're like, oh, it needs 2 quarts. The light's still on, right? Well, maybe it needs 3 quarts. Maybe you were that low, right? So the light stayed on even though you thought you fixed the problem, right? So I talked to him about that. And then most people can understand oil changes and lights coming on. And so if you explain that, like sometimes we thought we got the problem done because that's what we thought was needed, but it just needed more and more and more. And until the car is satisfied, the sensor is satisfied, we got to keep working, right? So
when you said that reminded me of something earlier this week where it was a duration thing where I said, hey, you're doing everything right. We haven't hit the results we wanted, but we're 9 days into this thing. 2 sessions, 9 days in. And I feel with a high degree of confidence that if we just keep this runway and we just lengthen it from 9 days to like 30 days, you're really going to see that this is all an accumulation. It's like you're depositing savings, it's going to add up to something. And I think that resonated with him because he was like, oh, okay, well, that makes sense to me. If it's a 30-day problem and we're 1/3 of the way through, I'd say I feel like 1/3 better, really, he felt kind of the same, to be quite honest, but in his particular case, it's really like we need the duration of time, the consistency of time for it to start to make an impact. Just because with his particular thing, it's like a 3 or 4 year thing in the making. He was like February, March of 2020 is when, and it's like, well, looking at that's 4 years.
Yeah.
So you want to undo 4 years worth of stuff in 10 days? That's
not real.
That's not realistic,
Yeah. Well, that's one of the troubles we have that I find with chiropractic is because we'll throw out, oh, you need 30 sessions, you need 20 sessions. They're like, how do you know that? Right.
Sure.
And you're like, okay, well, so I try to set it up on the first 2 appointments, talking to them about duration. That's part of our treatment plan, is talking to them about frequency and duration, how often. And I like to back it up with, so they understand. I said, have you ever heard, people get sent for physical therapy, the medical doctor writes off for 12 sessions, right? I said, you realize that 12 session comes from research that's been done. And it's a typical 12 sessions is what it takes based on research to get somebody 50% improvement for low back pain. So that's where that arbitrary 12 came from. So imagine that. That means if you're a 8, to get you down to a 4, it takes 12 sessions, okay? Whether that's 3 weeks or 12 weeks of care, depending on how frequent you come, it will take 12 sessions to get you 50% better. I said, that's a lot of care for 50% improvement. I said, but you have to understand that's the reality. And that's based on years of research, thousands of people, right? So I said, it's not just us making up these numbers. I said, I expect better improvement than that because we're going to be working with you and it's going to be a continuous team effort. And we're going to make other types of changes not just based on, so our improvement should be better. But so that's one part to get in their mind. And then I also talked to them about, like we've talked about, the neuroplasticity talk, right? And sure. I explained, because the question always, well, how often should I do these movements you're asking me to? I said, okay, well, there's a couple of different answers, but here's the basics. I said repetition is key, right? So the more often you do it, the faster you'll get better, right? And most of our athletes, our patients work out or go to the gym, and I use that analogy. I said, if you go to the gym 1 time a week, you're going to get results. But if you went 3 to 5 times a week, your results are going to be quicker, right? So the frequency is up to you. I said, as far as neuroplasticity, that's kind of that muscle memory thing you hear about. I say, I said, I just want you to hear this just for the number's sake, but this is what research shows. It takes about 300 to 500 times of you repeating a motion to actually get the brain to wake up to that motion. That's 300 to 500 times of you doing it just for the brain to say, oh, he wants me or she wants me to do this. And after he wakes up, it takes another 3,000 to 5,000 times of you doing that motion to make it ingrained into the pattern. So that's a timeline thing, right? So when you come back to me after 3 days and tell me you're no better, I'm going to ask you, well, how many reps do you think you put in? Are you close to your 300 to 500 to even waking that up? No, I haven't done that many reps. Okay. Well, it's going to take some time. So don't forget that just because you're not better right now, you got to get to your 300 to 500 reps just to start feeling better. And then another 3,000. And again, it doesn't mean you're going to take 3,000 reps to feel better. It means you're going to start feeling better way before. But most people give up on their homework because they're feeling better, and then it comes back. That's because they didn't put in enough time to ingrain it and make the pattern stick. So I said, once you feel better, that's not when we're done. We have to keep going, whether that's in-house or on your own, to hold this pattern. So we set that up first couple of appointments. So when they do come back and they're not feeling better yet, we remind them of those things, right? So I think it's really important for the educations right off the bat. So our expectations are set realistic.
Sure. Yeah, I think that's well put. I want to hear those numbers again, but it reminded me of an analogy I made a couple months ago to a young patient, along the same lines where it was like, man, we need to continue with the work. He was young, entering college basically. And well, I think he's a senior in high school, but going to college, has some looks to play collegiate sports. Anyways, I was saying, hey, this is like a bucket. So imagine a bucket that you're trying to fill with water and that bucket has a hole in it. So you filled the bucket up and you're like, man, my bucket's full. Meaning like I'm now out of pain. I've done these exercises. I've done these movements that you said. I've done the homework and now I'm out of pain. But I'm like, that bucket has a hole in it. So you filled it up with water. Well, you don't continue to fill that bucket up. The level of that water in the bucket is going to now diminish and go down because you have a hole at the bottom of the bucket. That hole is analogous to me to like life. You wear down from sleeping, from working, from stress, from all these things. And so you have to continually do the work. It's not like you he's a car guy.
Yeah.
It's not like you wash your car once and you detail it on the 1st of the month and come the 30th of the month, it's still fresh and clean. Like you're washing your badass car a couple times a month, if not weekly, right? And why? Because you want it to look its best. You want it to perform its best. But yet you're doing these movements till you just barely cross this threshold. And then you're like, now I'm done. Like, no, you're not done. You just barely got to the tipping point. That's like boiling water, getting it to 212 degrees and then turning off the stove and wondering why it's not boiling anymore. It's like, well, you just got it to that point and then you turned off the heat.
Yeah.
Stopped doing the work. So of course it's not going to boil anymore. You want to continue that boil. You got to what? Continue with the heat, continue with the work. And he was just like, damn, Doc, you're always busting the analogies out,
Yeah, that's
I said, I'm just trying to get through to you, dude. I'm just trying to make you see that it's not there's not an end goal to health, right? Like, it is a work in progress. And so, give me those numbers again, because I thought that was really interesting about reps. And what did you say, 300 to 500 and a few thousand?
Yeah, 300 to 500 is what was showing for the neuroplasticity to just kind of get the brain to, I call it wake up. So that's like my kid tugging on my shirt saying, Dad, 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 300 times, right? Before I turn to my kid and say, what do you want? Right. And so, but I still haven't done anything with what they've asked. Right. So it takes you 300 to 500 times to get the body saying, oh, they want to make a change. They want to make a change. Lots of reps. And then another 3,000 to 5,000 to actually make that change stick. Okay. Because remember, with that neuroplasticity, we're building grooves kind of in the brain, right? And so what happens is with a lot of bad habits, that's what I have to remind my patients is bad habits have formed. How many times have you sat like this, leaned, watching TV and for years, and now when you go play and you're upright, it's hurting. Well, your brain thinks your resting position is normal. So we have to retrain that, but it's going to take a lot to get out of that groove, right? So the next numbers were 3,000 to 5,000. It was what was found to actually make the change hold so it doesn't keep jumping out of that pattern. So that's like after 3,000, 5,000 times, I finally do what my kid has asked me to do. Yeah. So I use those kind of analogies, but with my especially with parents that come in, then they're like, oh, okay. So that way, when they do come in, I remind them, like I said, like, where are you in your numbers? Not there yet. Okay, well, keep going. Here's the other thing. It's like that 3 foot from gold or whatever. There's a story about like, digging for gold, and the person stopped 3 feet short of the goal, and then somebody else came in and dug the next 3 feet and found the gold line, right?
Gotcha. Yeah.
Well, that's what I tell people. Like, what if you stopped at 2,099? 2,099. I said, you never got. How many times do you have patients call you and they're like, after months of care, and they're like, Doc, I don't know what changed, but the pain is gone.
Yeah,
it had nothing to do. It had nothing to do with anything we've changed or they did, but time. And that's a perfect example, because we see it all the time, is about this neuroplasticity. Nothing changed except they hit that 3,000, 5,000. It's not a magic number, but the point is they finally got to the point where the brain said, I'm done. Boom. Yeah. They're fine. Right. Yeah. But if you stop too soon with your homework, you never know if you're going to get there. And that's so I tell people, I said, you have nothing to lose, everything to gain. Just keep moving forward. They're not hard. They're not hurting. They don't take a lot of time, especially the way me and you help people, 15, 30 seconds at a time per movement. Just get it in, get it done. Doesn't matter when, or you got 24 hours to get them done. Right. So.
Yeah, it doesn't mean 3,000 to 5,000 reps is 3,000 to 5,000 days, one rep a day. Yep. You're doing 10 reps a day. Now you've cut that, tenfold, right? And so, that also reminds me, you're really triggering a lot of memories today, but it reminds me of something. I was talking to a guy on another team about just repetitions, and, he plays defense. And I was saying, man, I was talking about his hip turn and like how quickly he's like going from back pedal to turning left, back pedal to turning right, and full sprint, from a back pedal to a turn and a full sprint to go. Like if you're guarding a wide receiver on like a go route or something. Anyway, I was making a comment about his technique, and he's like, man, it took a lot of practice. And his exact words were, took a lot of repetition. And I said, is that second nature to you? And he said, yeah. So we started talking, and we were just talking about muscle memory. And my comment to him was, it's like in my brain, I visualize if I'm trying to do a new movement. For instance, for me, I'm trying to learn to play piano, but unconventionally. I haven't committed myself to learning to read music. My in-laws teach music, teach piano in particular. My wife knows how to play. And so I asked her, to her dismay, to teach me how to play piano, but one key at a time. Like, I want to learn this song, just teach me a key at a time, and I'll just memorize it. I have a great memory. I can memorize all these keys. And she kind of was like, boy, you're crazy. Like, so I started to learn it. I'm like 30 seconds into it, one key at a time. But I was saying that in my mind, it's like I'm taking a walk through a meadow with long grass. And so the first time I walked through that meadow of long grass from point A to point B, I'm like barely knocking that grass over. I walked that same path 10 times. Now that grass is flattened. I walked that same path 100 times. Now that grass isn't there. I got a little dirt path. I walk it 1,000 times. Now I've really grooved in. Hey, that's a path right there, Yeah. And that's how I think of a new movement, where I'm like, this is the first time I'm doing this. It's the first time I'm playing piano. I'm like just trying to hack through the meadow with a machete and just make a path. And after 12 times, there's a little bit of a sign where it's like, oh, this is where I need to go. This is familiar. And so that was my visualization to him. And
I love that. That's a great one for me.
A few weeks later, he said, hey, you remember you were talking about building a path? And I said, yeah. He goes, I got an MF freeway going, He's like, I've laid down pavement. I've done the work. I've done this.
Attaboy.
And I said, man, that's better than a walking path. You got a whole freeway, bro? You laid down some asphalt? That is grooving in your habits,
That's great.
But yeah, so point being, I think that's awesome. I hadn't heard of those neuroplasticity numbers. I'm going to borrow that from you if that's okay.
Yeah, of course. Love it. I got it from somebody else. So let's go. Spread the word.
Yeah, man. Well, let me switch gears with you for a second. I really enjoyed that talk about patience and stuff, but I want to talk about this weekend's football games. We have 4 teams left, 4 teams standing to the Super Bowl. On the AFC side, we have the Ravens and the Chiefs. The Chiefs are back in it again. I was hoping the Bills won, but we have the 2 best teams standing.
Yeah.
And then on the other side in the NFC, we have the Niners versus the Lions. Niners are, a dynasty from years and years ago. Their last championship in 1995. They've lost 2 Super Bowls since then. Most recently to the Ravens in kind of a famous matchup, brother versus brother, Harbaugh versus Harbaugh. And so I want to just discuss like the Niners versus the Lions in particular, what injuries might make an impact on this week's upcoming games on Sunday. And there's a couple of people that I think are really, really critical to both teams. On the Niners side, Debo Samuel, he got hurt last game with a shoulder injury, so we'll talk about that. On the Lions side, their tight end, Sam Laporta, is a rookie, and he's been dominating, and he had a knee injury a couple games ago. He did play last game, and so I wanted to discuss that as well. I think they're 2 key players. I know you might have some insight or thought. Is there anybody on those 2 teams that you're looking at to see how they're moving and what kind of impact an injury may or may not play?
No, a funny story about Sam Laporta. One of my patients came in, and we were recapping the games, and he's like, man, I'm so happy for, him. And I'm like, F that guy. I said, he's all, what? I'm like, man, I'm so pissed. And he thinks I have some insight. I said, no, he killed me every time I picked him on my fantasy teams this year. I said,
yeah.
No, but I love watching him. It was fun to watch him do his thing. I'm rooting for, Detroit, and it was fun watching him do his thing. But it was kind of fun. He actually worked with his dad back in the day, so he had a personal.
Very cool.
Yeah. So, as far as the injury impact, that shoulder thing, you're going to get into. Go ahead and talk about it. Well, I have a little insight on that, but go ahead.
Oh, that's great. Well, I know you had mentioned CMC was maybe not at 100% Christian McCaffrey. Yeah. So I didn't know if you had any insight on what was going on.
Were you talking about those games? Sorry. I was.
Yeah.
Oh, so yeah, no. So with the Christian McCaffrey thing, it was kind of interesting because all week I was following it. They were talking about his injury and is he going to be okay? Is he injured? What's going on? And it was kind of, so the latest is that he's totally fine. And the coach didn't even know really what was going on. He heard it from his family that he was hurt, and he's like, what's going on? But what the reporters were showing during the games was him getting his quad worked on during the game. And so everybody thought he was injured. And the coach said he's all, everybody was reporting on this, that he might be possibly injured. He's all, we haven't heard anything about any injury. He's all, that's just Christian McCaffrey doing Christian McCaffrey stuff. He's always working on his body. That's what he does. And I thought that was the best quote. He's just off on the sideline, just making sure he's tuned up mid-game. Yeah. And, I told you once before, I had the fortunate opportunity to kind of do some, meet him and do some work. And that guy is exactly what they said. He is so in tune with his body and just does the checks and balances, and it's for the health of it. And, he's a great, great guy. So I thought awesome. That was cool. That quote was funny. That coach threw that out there. It's like, man, this is just him being him. He just takes care of his body. And I love that. Right. I wish more people did that. So
that's a favorite type of athlete for us, is somebody who, one, displays some trust in us, or we gain their trust through the things that we do, but also, might continue to kind of learn. And I tell rookies that are in the league that I have the benefit of working with, like, hey man, whatever your degree was in college, you're now a professional athlete. And my expectation of you, if we work together for several years, is that by the end of year 4, I expect you to have your degree in your own body. You didn't go to school to be, a kinesiology major or an exercise phys major, but you're now a professional athlete, and your job is to be as prepared and as healthy as you can. And you're going to go through these years of being an athlete irregardless. You can just be aloof and have no focus, or you can say to yourself, hey, I am going to learn a little bit about nutrition. I am going to learn a little bit about why Dr. P does this thing. Like, what is he doing there? Why is he doing this? What is the benefit? And also, well, let me try these things that he recommends or that I heard Dr. Glass talk about, and let me see if that helps. And so to me, my favorite type of athlete is the one who wants to continue to get better and continue to learn, and also wants to learn things outside their scope. You know, they might have studied whatever type of thing in college, but now that you're a professional athlete, you should maybe become a professional, and part of that is like how you act, what you say, but also what you learn on how to take care of yourself. And so, you know, you think of the Tom Brady's or the people that you can, you know, LeBron James, Kobe Bryant, these people that really took taking care of their bodies to another level with a purpose, you know, and man, that really makes me happy. So to hear that story about CMC, and I saw the clip of him with the massage gun on his leg, and, you know, it's pretty cool that he's like, you know, this doesn't feel quite right. Let me get this and let me work on this area. Even if it's just psychological and it's not doing anything, it is doing something.
Yeah. I mean, and that's something that we need to praise more and talk about more for the younger athletes to see that it's okay to take care of your body. It's smart to take care of your body, right?
Smart, bro.
Like I said, I had an opportunity to be around him and just meet him and just hear, you know, his regimen and stuff like that. And what he's doing on the field is a testament to that, right? And so younger kids, pay attention. It's not always about, you know, not taking care of your body. These athletes have to take care of their bodies to the utmost, and he's doing it so much that we're showing it on the game and on the sideline. It's just smart, you know.
So, you know, I have to look up, there's a client of mine that's on the Patriots. He plays defense. He got injured early in the season this year, so he's been rehabbing, and I saw him yesterday, and you know, I was asking him, how's rehab going, and like, are you upset that you missed the whole season? Like, dang, I'm bummed for you. I wish it was week 10 versus week 2. You missed the whole year. And he said something I didn't expect. He said, nah, doc, I'm glad I got injured in week 2 if I was going to get injured, because if I got injured in week 10, I would have had to like stay at the facility in Boston, you know, from week 10 till the end of the season. And then if you think about when am I going to be 100%, that puts me back, you know, like I might not be 100% by training camp. The fact that I got hurt early in September, I'm already like, look at me, I can already do that, you know? And he's like, I'm better. And so he's like, I didn't have to stay in Boston. I got to come back to Cali. I rehabbed here. I had surgery the day after. I didn't have to stay there at the facility. You know, if you're injured, you're kind of I don't want to say outcast from the team, but you're not a part of team activities sometimes. You know, you're coming in for treatment, especially if you're on the injured reserve, or you know, then you're really unplugged. You know, if you're like 1 or 2 weeks, you're still going to meetings, you're going through all this stuff, but it's kind of like next man up. And so I thought that was interesting. He's like, no, I'm glad I got hurt earlier in the year, you know?
Yeah, that's a good perspective. Yeah. Kind of like, things we've talked about. We've talked about it, you know, from a sports medicine standpoint of timelines, right? But to hear it from an athlete, that's pretty cool. And a different perspective. And it was interesting to hear him say that. But yeah, getting back to this week's games, you know, we have the NFC matchup and the AFC matchup, and in particular with the NFC matchup, I don't know if you noticed or if you saw that 49ers game, you know, as soon as Debo Samuel got hurt, their whole game plan changed, and really it was quite a close game. And I mean, shoot, the Niners could have lost that game, to be quite honest. You know, the Patriots, the Packers, I should say, you know, really played the Niners tough, and I think part of that was Debo Samuel was a big part of their game plan and their scheme, and it's way different when you lose a key player during the game, because you already have the game plan set up. If Debo Samuel isn't playing in this game coming up this week in a few days, that's different. You know, Kyle Shanahan can game plan around that or figure out what's going on. So I think that was part of it, is just, damn, we lost maybe our best player, and there was some shock to that. But I did want to discuss his shoulder or his injury, because they didn't really come out and say, as far as I know, hey, specifically it's an AC joint separation, or it's just a sprained shoulder, or it's a bruise, or it's a neck injury, it's a stinger. I haven't at least read what it was, so I wanted to
just talk about some of the things that it could be and which one of those things might keep him out and which ones, would allow him to play even if he had, say, a sprained AC joint. I've had wide receivers with the same injury who were able to play. And I guess secondarily, maybe you can be in there and not be at 100%, but be kind of a decoy. Maybe you're running the ball instead of catching it, or maybe your QB knows, hey, my shoulder hurts. I'm wearing a harness. I can't go up above my head to catch it, so keep everything down here,
Yeah.
What are your thoughts, and did you hear anything about his shoulder? What's your insight on that?
So that's what I love. There's always more than just what meets the eye, right?
Right.
So from looking at, and we see the reports of he's out, the initial reports were, something's going on with his shoulder. Then the follow-up reports was, and it was interesting to your point, they said it's not fractured. Well, nobody was saying it was fractured, right? Or suspecting that. We just want to know what's going on. But it's interesting because you hardly ever you'll just see shoulder injury, but you never see it's not something, right? So I'm
that's correct,
that's kind of interesting that multiple reports said it's not fractured. So I dove into that. So I wasn't aware of this, but he had earlier in the season, he had a hairline fracture of that same shoulder. So
that's right.
So there's a backstory with that, then why that was on the minds of everybody in the locker room, in the medical staff, on the staff. Did he re-injure that same fracture, right? So It's just interesting. If you don't know that backstory, you're curious to why they would say that. So they were just happy that it was not a fracture. Okay, so but I mean, it's like soft tissue sometimes takes longer or it's harder to heal, but in the timeline of he only has a couple more weeks, he doesn't want that fracture because that's bone healing, right? Soft tissue, even though it will take longer to heal, you can manage that a little better. So it's so funny, time of year, right? Time of year, early on in the year, we would say, man, you tore stuff, you would have been better off breaking it, be done in a few weeks, healed up 6 weeks, then you're solid because all the tissue's fine, right? But this time of year, you don't want that break because there's only so much you can do with a break, right? So you can kind of deal with, pain management and soft tissue if it's stable enough for the next few weeks.
Great point.
So it's just so funny how we talk different timelines from a sports medicine standpoint, right? So as far as we know, and then the other interesting thing I read about that game, prior to him hurting himself, he went out on a head trauma, and he was evaluated for head trauma before the injury, and he was cleared. So there's other things going on, that might have been going on before he actually hurt the shoulder with his head and neck and shoulders to begin with, soft tissue wise. He could have had a stinger, right? And so that shoulder was a little more unstable, just from neurology of it. So who knows? But I didn't see the injury. Did you see the injury?
I did. And it looked kind of innocuous to me, like it wasn't something that right away you'd be like, oh my gosh, he's hurt, at least not to me. All my cousins in the Bay Area are huge Niner fans. And so my group chat was kind of blowing up like, yo, what do you think happened? What is it? And so just running down the mental checklist, you're like, well, it could be a stinger. It could be, he separated his shoulder. Maybe he sprained his AC joint. Maybe it's just a soft tissue bruise. Maybe he hit his head, and, you just need a few minutes to kind of gather yourself, So there's a lot of stuff that could be there. And then the next question was, well, think he's going to come in? You think, and it's like, well, it's hard to say because you don't know exactly what's going on. If I was on the sidelines and you and I were examining him and it's like, okay, he sprained his shoulder. This is a pain tolerance thing. Hey, Debo, we're winning this game, or I don't know if we need you to win this game. Let's just err on the side of caution and take your shoulder pads off, throw on the hoodie. It's a wrap today. Let's just call it, Sharing versus, hey, doc, I can't even raise my elbow at all. It really hurts. And you're like, well, it could be fractured. The x-rays are negative, but maybe it's a hairline. It's not going to show up quite yet.
Yeah.
So then you really err on the side of, well, you don't even have full range of motion, bro. You're sitting that's a wrap,
Right.
And then there's everything in between. So I didn't really have any insight. It's not like I had somebody I could call or text after the game, and I didn't follow up with the one contact I had to see how he was doing. I just a little bit of that is kind of personal, so I don't want to pry as an outsider and be like, hey, what specifically is going on? But as far as him playing this week, which is really what everybody wants to know, is he going to be okay to play?
Sharing.
I would suspect that if he can go, he will go. And further, I'd say that if he can suit up and not be at 100%, I would expect him to be in the game, because they run him on a lot of, say, jet sweeps, or they can use him as a decoy even. If he's on the field, you have to account for him. And so if it's a shoulder issue, you and I both know that, look, you can go out there and run your routes, and if you know you're not getting the ball thrown to you, you can still impact the game. I would say that you can really impact the game. And so to answer my cousin's questions and some 49er fans who come in this week, I do expect him to play without having any insight, just based on the differential diagnosis of what the injuries could be. The things that I think would keep him out would be something like a fracture or a tear. And since we haven't heard anything a few days post-game that, hey, we took imaging again, we took an MRI, something's torn, I would suspect that they're managing it conservatively, trying to get him, get his pain level down, probably more than anything else, right?
Yeah, he didn't practice yesterday. So, to your point, resting it, letting it have another day, get the pain down. They said he was in a lot of pain after the game. And so that knee-jerk reaction for me is, having the history of the hairline before, when he probably first injured or, hurt it, his mind probably went right back to, oh man, there I go, I'm out for the Super Bowl, right? So
right away,
right away, your mind goes that way when you've had a pre-existing injury, even especially this season, right? So I'm sure he was very relieved to know once he found out that it wasn't, and now it's just a matter of getting the pain down, rested up. I think, like you said, it's a sprain strain of that area, and he'll be good to go probably.
Sharing.
Yeah, Kyle Shanahan, his quote was, "It wasn't broken, so that was a really good sign," which is like,
that means I have no clue. I know that being not broken is good.
That's a good sign. Yes, that's correct. Coach, that's correct. He says it's still hurting too much for us to have any idea on how it's going to heal up this week. We have to be patient, see how he feels on Wednesday, and based on his improvement, it will give us a better idea of whether he has a chance for the game or not. And so to me, even though that sounds like, man, it's kind of up in the air, if I was betting, I'd put $1 on he's going to suit up and play.
Me too.
He's going to come down that tunnel with Trent Williams and that boom box, and they're going to be coming out this Niners tunnel, probably hyped up. And I'm really excited to see. I'm really excited to see this matchup. The Detroit fans were unbelievable. It was crazy loud in there. We remember when we asked Corey Legit, when he came in, what some of the loudest stadiums were, and he said, man, Kansas City was crazy. I'd be willing to bet if we were in Detroit that Detroit was one of the loudest stadiums of this season.
Yes.
That place was humming.
Yeah.
It was crazy there. Yeah. So
it means a lot to those fans. That town means a lot.
Yeah.
I tell you that about that guy crying in the stands after that win, not last week, the week before. And,
what was the backstory on that?
What a story, man. So him and his dad used to take him to the games any chance they could. So he grew up, but his dad passed away, I think, when he was 12. So he has those great kid memories of his dad taking him to the games, and every game they would go to, his dad would basically say, "This is our year. We're going going to the postseason. This is our year." And for those 12 years, never happened. And so for that game solidified them going to the postseason, and he just broke down.
Right there.
Yeah, me too, as I'm telling it. So he broke down in that moment, and of course social media caught it. And but that's what it meant to him, is like he basically telling, and the interview was great that I sent you. He actually was telling the girl that, I, as an adult, I've never known my dad as an adult. I've only known him as a kid. So I have a different perspective. So when that happened, I was 12 years old again. So that memory was me being 12 years old again. And, my dad being there for. So, and yeah, so really cool.
That is sports encapsulated.
Oh man, yeah. So really good moment, good sports moment. Hopefully somebody can rally up and get that guy to another game. So you think that
Gosh, did I read that he was going to go, that somebody was sending him?
I don't know.
Don't quote me on that, but I thought maybe it was another fan who hadn't been to a Detroit game before and they sent him, but that would be great if he could go.
Right.
I think it was in that clip that you sent me, Dustin. It said that when his dad passed away, he was 35 and he's now 35, the same age that his dad had passed.
Yes, that's right.
And that's, that hits you a type of way too.
Yeah.
It's a
crazy story, right? I mean, if Disney is listening, that's a Disney movie in the making. Let's do a story about this, especially if Detroit goes all the way.
Man, it's a beautiful thing. That's why people love sports. It I think it unplugs you from reality for a second. You get to cheer on your team. You get to be a kid again and be a fan. And also there's something to collective
sharing,
sharing. I don't know what the word is that I'm looking for, but there's something to like collectively cheering on your team with a whole bunch of, there's some unity there. You go to a game and everyone's wearing your jersey. You're like, hey, we are in this.
Yeah.
We are going to win, and that clip really captured his emotions, and I think that it really touched everybody. So it's awesome that Detroit's in it. I'm glad that it's going to be a great matchup. On the other side, to talk on the injuries, their star tight end, rookie tight end, Sam Laporta, he played through an injury in the last game in Detroit. He had a knee injury and he was able to play with the brace on. Did you catch him? Did you catch any of that game and see how he was moving, or what are your thoughts on that? And I guess secondarily, since he played through that, I believe it was an MCL sprain, some sort of knee sprain, I can't recall now. But do you think he's going to be better this week since he played through it last week, or since it was injured and he played through it even though it was with a brace, you think he's going to be, a standard deviation, more sore or less mobile this week? What are your thoughts on that? And did you read anything about that particular
I didn't read
injury?
anything about it, but from experience, I think he'll be stronger. I think he'll be better. Yeah, I think because it's that first week back when you're playing with the brace, playing to see, and then it's the mental side. Once you can do it, and he had a good game and he was able to perform, it's like you got that, monkey off your back and you're like, okay, I can do this and I can perform well. So I'll be fine. And so barring that he didn't injure anything more, during last week, I think he'll be that much better this week.
Yeah, I agree. That's kind of was my, 2 cents of opinion on that, was since he was able to gut through it last game, he should be able to gut through this game. He has another week of treatment, and also the confidence that he was able to go out and play the week prior, coming off any injury. I mean, even all pro athletes, when they've been injured, there is a little bit of, well, let me go out there and let me see. Like, I'm not 100% sure. Like, it felt good in practice, but practice isn't the game. So let me see how this feels. And so I think he should have that confidence. And man, it's going to be a slugfest, dude. What's your prediction on that? Niners or Lions? Don't tell me who you want to win. Tell me who you think's going to win. I
think Detroit's taking it all the way.
Oh shit!
Yeah, I'm predicting that right now. They got too much piss and vinegar. They are motivated. Kansas City's been dealing with a lot of BS media and a lot of, Patrick Mahomes been, doing his whining thing, and it's just a kind of a shit show over there. And they got Andy Reid, answering questions about Travis Kelce and the Kelce brothers and Taylor Swift, and the focus is not on winning Super Bowl. I mean, I know they want to, but there's so many other distractions where the Lions are just like, they're like freaking determined, and you get a bunch of, Detroit's just a blue collar, city that just, I'll go to war with them any day.
Yeah, you know what? And honestly,
and
they
Coach, remember Coach, we did that whole podcast with Coach, with the Ventes and the Red Bulls or whatever. I forget what it was, but it was ridiculous.
I'm going to be really honest here. everyone made fun of Dan Campbell, Coach Campbell, when he came out and he was a little bit, not abrasive, but just a little bit unconventional in the way that he was communicating in press conferences. And two things. One, I feel like everyone was like, oh man, they made the wrong hire as coach. But everything he said has come to fruition. You know, he spoke the vision and he's like, we're going to be a tough, hard-nosed team. And that's what they are. And one, I'm glad he got the chance to have the runway to create that kind of character of the team and create that, type of squad, basically. Because he could have, been let go after year 1 or year 2. And I also think it's awesome that he was on the winless Detroit Lions, the 0-16 Detroit Lions, and now they're in the NFC Championship game. Yeah. It's a pretty awesome thing. I was looking around here to see if I had a hat because I was going to put my conspiracy hat on here, because you are right about the Chiefs having all of this outside
noise,
attention.
Yeah,
I won't say distraction. Maybe the attention's good. I'm sure the Chiefs, bottom line has gone up. Their popularity's gone up. There's been a Swiftie effect for sure. Man, I think the Chiefs are good for the NFL and for their branding. And so I hate to be this guy, but I wouldn't be surprised if there's a PI call here or there. There's a holding call here or there. There's some subjectivity to refereeing in football.
Yeah.
And look, I think it's super, super, super weird that this billion-dollar industry still has, 2 retired old men with chains that they carry to measure a first down when we can GPS laser something from outer space to inches. Why are we using anyways?
Yeah.
Don't get me started on that. But I do think, I think if the league was picking, they'd rather probably see Mahomes and the Chiefs and Travis Kelce and Taylor Swift.
Yeah.
And 2 weeks of yippity yappity going into the Super Bowl versus Lamar. Lamar Jackson and the Ravens, they are a good story. They have Zay Flowers, rookie. They have Lamar, who isn't a good quarterback because he's not prototypical. Lamar's an MVP. Get off that guy's back.
Exactly.
And so I'm rooting for Niners Ravens. I'd like the Niners to win, make up for that Super Bowl loss when actually the Harbaugh brothers played each other, which I mentioned, So that's what I hope. I wouldn't be surprised if the Lions beat the Niners. I mean, I think they are.
Yeah.
They're one of the top 4 teams for a reason, and it's going to be a drag out, game. I think that game is going to be a lot closer than the Baltimore game. I do think Baltimore is the better team by a standard deviation. I think the Chiefs have done well.
Yeah.
They've masked their injuries. They've masked their deficiencies. So those are my thoughts on it. I think going into the week, Debo Samuels is probably the most important injury out of all 4 teams out of the 2 games coming up, that I'll be looking to see. How is he performing? How's he moving?
Yeah. It's going to be fun. I'm looking forward to watching it.
Yeah. I have one last question for you, man. I had a kind of a list of 5 or 6 things, and we, started talking about other interesting things, but I did want to touch on one thing before we sign off, and it was something that I had 3 people this week, 2 this week, 1 last week, come with the same question and the same curiosity, and it was about why they have morning stiffness in their ankles particularly. So I had one female marathon runner in her 30s. I had a male who's not an athlete, regular guy. He's in his mid 40s. And I had another active working guy who's in his mid to late 30s. I think he's 38. And all of them were like, hey, I'm waking up in the morning and my ankle hurts, or my ankle is stiff, or my Achilles feels like it's going to pop, or I'm limping for minutes before I can walk normally. What is that? Why is that happening? Am I going to blow my Achilles? Am I getting arthritis in my ankles? What the heck? I'm too young for this. And so I had a different but similar answer for all three of them. And then ironically, I don't know if I was thinking about it too much, but I woke up the day before yesterday and I was kind of limping around with my right ankle. It felt super stiff. And I said, oh man, here we go. Like the universe is sending me a signal to understand what my patients are going through, you know? What are your thoughts on that, man? You think that's just old age? You think it's just, you know, we need to get the blood flowing, you're stiff after laying down? And have you had somebody approach you with a similar question?
It's something I hear about a lot of times, especially in the spine, right? We deal a lot with the spine. Why is my neck always stiff? Why is my low back stiff in the morning? It could be for any joint, but by definition, if there is any kind of degenerative change, osteoarthritis in a joint, by definition, when you look it up, one of the symptoms will be morning stiffness or stiffness in the morning, by design. And that's typically because normally a joint will have a certain amount of space between it that's physiologically healthy, and we have no issues with that. And so the body is designed to move and flex and bend and do all its things without feeling anything, being aware. We have receptors in between the joints that tell it what position it's in, or how much tension's put on it. So if it's healthy and the joint space is healthy, we're not aware of anything. Now, if we start getting degenerative changes over the years, and it takes about 12 years to even show up on an x-ray, over time, that joint space will decrease due to that osteoarthritis. And what happens is now you got a space closer, so those sensors will be more apt to being triggered.
I see.
If anything affects them. Now, from day to day, we don't feel them. But what happens at nighttime is we are not moving. So what happens is the muscles above and below the joint shorten down, and that joint space gets narrower at night. Okay, and then when we first wake up, the joints are short, compressed. So we're putting pressure on those sensors, and then when we get up, the first few steps to 20 minutes of getting the blood flow going in our muscles, and then those muscles expand again, allowing the joint space to open up, then it goes away. So if we see that pattern, it's typically due to some kind of osteoarthritis. Now, a lot of people are, it's just an age thing. Osteoarthritis is a movement thing. It's not I have 12-year-olds with osteoarthritis.
Correct.
So a lot of times these patients, I'm only 30, I'm only 50. Well, this started at least 12 years ago. So did you roll your ankle? Oh yeah, in basketball when I was in high school. Okay, what did you do for it? Oh, not much. Once the pain went away, I was fine. Yeah, So over time, that joint didn't move as much as the other one did. So with time, it started to have these issues. The calcium and everything just started to, basically your body's trying to fuse it and protect it for long-term life. And so that's the conversation. So that's what I typically see, and that's the conversation I have with them. And I say, don't worry about it. At this point, there's nothing you can do with the osteoarthritis, but you can do is prevent it from progressing more. And the way you want to do that is to loosen up. So on those random days that you do wake up more stiff, just instantly in your head, don't go down a rabbit hole that something's wrong. Just realize you got to get your muscles moving. Maybe jump in the shower, get moving, walk around. You'll be fine. Massage it before you even wake up. Put a foam roller in bed. Rub it with BioFreeze. Do whatever you have to do to get those muscles good. You'll probably be fine. So
yeah. So your I guess advice on that would be concern level low and ability to create change positively is there, right? That there's things that you can do to improve that.
Yes. And so
I had mentioned to this particular patient who wasn't doing too much. I'm like, what's your daily? And it's like, well, I walk and I sit at a desk, and it's very just one motion, heel strike, toe off. It's like very linear. So it's not like you're an athlete that's doing lateral movements or change of direction and your ankle's getting all this work. It was very linear. And so I just was like, well, let's get a foam board, a foam pad. Let's stand on that, get a little bit of ankle mobility with the foam pad. And if it's really, you feel like you have some stiff joints, let's work on that mobility, because it's probably stiff because you're moving it in one plane and your ankle's made to move in all directions. Well, many directions. And so that was one piece of advice. And the other thing I said was, when do you feel that most? Oh, when you get up out of bed right away. So the alarm goes off, boom, you're up and out. How about you hit your alarm off, lay in bed,
sharing.
And let's stretch, let's stretch those legs out. Let's stretch those ankles. Let's get some, circular motion in those feet. Let's stretch those, curl those toes. Let's get some movement in the ankle, pump those calves, get some blood flow before you get up out of bed. It doesn't have to be a 5-minute thing, but you can spend 30 seconds, 60 seconds kind of waking your body up after it's been static. Then maybe when you get up, those first few steps don't feel so rigid, so stiff, and I haven't seen her since I gave her that advice, but she's also a marathoner. She's running like a couple thousand miles a year, literally like multiple marathons and averaging 6-7 miles. She wants to run 2,024 miles this year. And so I don't know what that average is, but it's a lot of miles per day. And so for her, that might contribute as well. But that was interesting how you broke that down, because it's not an age thing. You're right. People hear osteoarthritis or arthritis, they automatically think, well, I'm not a grandparent, I'm not my parents' age. So I think that's a very good point that you made,
Yeah, I think it's important for people to realize, and that we can prevent that. That's why we try to talk to our, patients as early as we can, even when they're younger. Hey, this is, even though it doesn't mean anything to you now, but we got to keep spinal mobility, keep each segment moving, all your joints moving, so you don't end up with osteoarthritis. Oh, that's an age thing. No, it starts right now. So let's
starts now.
Yeah.
Sharing.
Well, I appreciate the insight on that. I always like to bounce some things off you. Just even if I feel pretty confident about what I've told people, it's always good to get another angle, another opinion. Sometimes it kind of expands my mind a little bit.
Yeah, for sure.
So I appreciate that. Lastly for today, Dustin,
sharing.
I do want to spend just a second, a minute maybe, talking about our next 50 episodes. So at the 50 mark,
sharing.
We spoke about it earlier. I'm pretty happy with the process and our growth pattern. I'd like to commit to another 50 episodes and see where we're at episode 100. So if we could speak it into existence, or we're listening back, to our
sharing,
at episode 100, and we're listening back to episode 50, what would you want between now and then that we've had accomplished, or what are your thoughts to where we'll be at episode 100 versus today?
Yeah, I think if we can multiply what we've done and kind of fold it forward, I can envision us having a better system, right, where it's an actual uniform kind of studio type thing. Even if we're doing Zooms, we all have the same equipment. Everything the quality just raises up, right? Just I want to compete with some of the other podcasters out there that are doing it on a regular basis with a team, a studio. I believe we can get there. I believe we can get the right people in our surrounding that can help build that with us. And obviously I'd love to start having regular guests of all industries, in healthcare and sports medicine, and start building a community of podcasters that want us on their show as well, right?
Yeah.
And have a mutual podcast experience with these people.
Sharing.
No, I think that's correct. We've had a couple opportunities to go on. We just haven't been able to carve out the time. And yeah, the guest thing is a big part of it as well, just to document our friendships and our experiences, and also be able to share some of the things that we encounter on the day-to-day. I think it's really interesting. I don't know how interesting you and I are, but I think it's really interesting to learn about other people's lives and how they got to where they're going. So next week, when we're scheduled to have a guest, we're going to have a good conversation about life and the sports and challenges. And that's what I really like, the human aspect of it and getting to know people. And so if I was to speak it, I'd say in the next 50, I'd like to have 20, 25 guests along with what we do on the weekly, and just continue to get smarter in life and get better at what we're doing, get better at interviewing people, get better at explaining things that are complex to the everyday person. That's all a skill set too, just like adjusting. And I feel way more comfortable at episode 50 than I did episode 1. And I think we're developing a little framework and some consistency with what we talk about and what we do. And sometimes our conversations go a little freestyle, just like we're having a normal conversation in the car. And I enjoy that as well.
Yeah.
It doesn't need to be super rigid. We've done podcasts with no agenda, and we've done podcasts with highly structured agendas, and they've both been fun for me.
Yeah.
So
I agree.
The other thing is I continually get Kobe Bryant motivational clips, and I have a few sweatshirts that say better than yesterday, and his whole, a lot of what he says is just continual improvement. It's about repetitions. It's not about the end goal. And that's kind of how I feel about our podcast. I rarely look at the metrics on how many people are downloading or following us or viewing us. I just look forward to like, hey, what am I going to talk to with Dustin, and let's chop it up. And this is what I'm trying to learn. This is what I'm trying to explain. And the rest I kind of feel like will fall in place,
Yeah. Well, tomorrow's one of the anniversaries of his passing, him and Gigi's passing tomorrow. So interesting you bring that up. But one of the things, obviously during that time, a lot of internal reflection and stuff. And what kept in my meditations, his voice, and through all our talks and everything, I just kept hearing the word momentum. Keep it going, bro. Keep it going, bro.
Yeah.
So that's what I want for that next 100, is to kick off that momentum. That's why I was so hell bent on when you said, hey, let's do this. Let's make it happen. Keep that momentum going. Right. And so, but that's all that kept resonating in my head. His voice was momentum, because we had some things we were talking about, some things that we were excited about doing to, and we always had these, bounced ideas, a lot like what we do, bounced ideas off each other and stuff. And so, I want to make sure I can see that through somehow. So,
yeah, look, I didn't know him. You guys had a close personal relationship, and sharing. Man, I remember that day pretty clearly, and I thought I might have lost you as a friend, so that was a super challenging day. And also, we've had a lot of similarities, like you've lost a friend in a helicopter crash. I've lost a friend in a helicopter crash. This year we both lost our, animals, our pets, our family members. And so I don't think it's coincidence that I kept getting hit with all these Kobe motivational clips.
Yeah.
Because every time I heard something, it was kind of like, man, you keep talking about doing this thing with Dustin. Fucking get on it. Let's start the process.
Yeah.
And it was really overwhelming to think about, well, there's a lot of stuff. We got to buy equipment. We got to, and it's like, you don't have to be perfect to start, you just have to start. And so even though I didn't have the pleasure of meeting him and knowing him, in a weird way, he does motivate me. I don't think, like I said, I don't think it's coincidence when things come across my news feed. It is partly my algorithms.
Yeah.
But I think there is some universal synchronicity there. I do believe that. And I don't think anything's a coincidence. And yeah, it motivates me. And, I'd like to just continue to get better. I think that's, if you talk about Mamba mentality, that's one of the things, and you could speak on it better, but I want to make our friends proud and make you proud and make, people who listen to us feel like they didn't waste their time tuning in. And we're really lucky to be surrounded by great people who've achieved exceptional things. And if a little bit of that rubs off on us, I feel blessed. And if we can pass a little bit of that on, our experiences or shared experiences to people, what the heck are we on this earth for if not to do that?
Right. I agree. Well said.
So sharing. Yeah, man. Well, I'm looking forward to Epi 100. I've been doing something lately where I visualize something I need to do in the future. Like, for instance, today I have a very long day. I got this podcast. I'm in the office. I have a home visit, back to the office, back to a home visit, and then I'm back home. And so this morning I woke up and I visualized, actually wearing this sweatshirt, doing this podcast, visualized the scrub top I'm going to wear to work today, going through all my appointments, not one by one, but being like, this is what I'm wearing, this is what I'm doing. And by 6:30 p.m., I'm going to be done with that last appointment. And how am I going to feel when I walk out of that house? I'm going to be a little bit like, whew, I got through the day, but also I'm glad I did some good work. And so I just thought forward about just basically visualize what the end of my day is going to be and kind of congratulated myself for getting through the day, even though I haven't yet. And then hopefully at the end of the day, about 6:37, I'll remember, man, I was thinking about that this morning, 12 hours ago. And then I'll give myself a little pat on the back for having accomplished the thing that I'd visualized I was going to accomplish. Does that make sense?
Yep, that's good.
I've been doing a lot more of that, and it feels like I'm almost creating my reality, as weird as that might sound. And
good stuff.
I've been doing it in shorter and shorter increments. So not like, hey, episode 100, where do we want to be? But I've been like, hey, I got this pain in the ass thing I got to do today. Let me visualize completing it successfully. Okay, now let's go do it. And then at the end of that, being like, hey, you did that just like you said you were going to. You made that into a reality. And I think there's something to doing that frequently. Maybe I'm just being hokey, but I kind of feel like I got a little sharing a little hack on life by doing so.
I like it.
What are any thoughts to that? You think I'm being weird, or you think there's something to it?
Not at all. That's huge in the mental game. Sports coaching and training, and with our athletes, I've been fortunate to sit in with a lot of good sports psychologists, team bonding things, coach meetings with players, and some of the best coaches around. And that's a huge part of it, is visualizing, and manifesting it, right?
Yeah.
So,
well, we always did it with sports and stuff, but I started doing it with like, hey, I need to take care of this task, or I need to get through my day. And I never looked at it like that. And so it's been kind of fun. Anyways, I'll share more on that as I do more with it.
Love it.
Any last thoughts, Dustin?
No, ready to tackle the day. Still looks overcast right now. So hopefully it warms up a little. My daughter's got a soccer game tonight. So hopefully it's not too cold, but yeah. What about you? Sounds like your day's planned and ready, and you're going to go get some breakfast, work out. What are you going to do right now?
Yeah, I'm going to get a little movement in. I got about 20 minutes to, I wouldn't call it a workout, but, push a little weight. And then, part one. This is part one of the day.
Yep.
Part two is kind of this workout and get out of the house. And then I got 6 parts to my day today.
There you go.
Just chunking it up one at a time.
That's what that's what it's all about, is chunking it up, right? People that's why I even told my mother-in-law had knee replacement surgery last night or yesterday, and I texted her this morning and I just reminded her, take it one moment at a time, right? Because if you take it in the whole day, like, a lot of pain, whatever, then it makes it very tiring and exhausting. But if you take one moment at a time, like, I'm sitting in the chair for this next 20 minutes, I'm doing good, great. I have to walk to the bathroom. That's another moment. Don't look about, and so chunk it up. Like you just said, it makes it so much easier to deal with things.
No, it's true. It's a good point. It's a good lesson, not only in recovery, but just in general, tackling big things,
Yep.
Well, man, congratulations on episode 50. I look forward to episode 100, my friend.
Yeah, me too.
That's the next little milestone. And the swag looks good on you.
Thank
I like the pro sports stock.
Yeah. Almost color coordinated, white, black. Look at that. White in the back.
Sharp, bro. You're looking sharp.
Who am I?
That's awesome.
Yeah.
Well, good, man. Have a good rest of the day. We'll touch base later this week. I might shoot you a text on Sunday during the games and just, kind of pick your brain on what you're seeing.
Yeah, please do.
I'm pulling Ravens, Niners, and you said you have the Lions, and are you Lions, Chiefs?
No, I'm Lions, Ravens.
Okay.
Yeah.
Lions, Ravens.
Yeah.
Got you. Okay. Down with the Chiefs.
Yeah, down with the Chiefs. I'm tired of seeing them. Now, they're good. They're a good squad. They're fun to watch, but I'm just tired of them. So, yeah.
Yeah. Let somebody else hoist the trophy, right? Yes.
Give it a little love.
Man, well, it's going to be an exciting week, dude. I'm hyped. Today's Thursday. I'm looking forward to the weekend. And, looking forward to next week's talk. We should have a guest in studio, which I'm really excited about as well. So,
me too.
Thank you for your time today, Dustin.
Thank you, brother. Have a good one.
You too, man. To all our listeners, we appreciate you. Even though the episode's done, maybe you can share this with a friend. Hit that download button. It does help our metrics. Always looking to improve in all ways, including that way. So we appreciate you. This is the Second Opinion Sports Medicine Podcast. I'm Dr. Dokel.
I'm Dr. Glass.
And we're signing off. Everybody have a wonderful day. Be safe, be healthy, and we will be with you in a few days. Talk to you soon, Dustin.
You too, buddy.